the topic given to me and Dr. Ranjit is that we are going to talk about over-the-counter continuous glucose monitors, data for all, or disaster waiting to happen. So first of all, let me tell you that this was also a topic of debate in the ADA in 2025, and it is important to understand the background. So somehow this background doesn't fit into the Indian scenario, and both Dr. Ranjit and myself we agree on this. And why this is so, it is important for the audience to understand, for all the participants to understand. So in the USA, how the CGM worked before 2024. So CGMs, they were classified as a prescription only medical devices. So before 2024, no one in the US could buy a sensor or a CGM without a prescription. So that is why the question that over the counter or the prescription based. So you need a doctor prescription, then you need a authorization from the insurance because the CGM is a costly affair. So first, insurance has also again to approve it, and once it is approved after these two processes, then the pharmacy or then the digital with the use of other tools, you get the CGM channel. And primarily, the only indication before 2024 was the type 1 diabetes. So anybody who is having type 1 diabetes will go to the prescriber. They will give a prescription for the sensor. The insurer will approve, and then they will get a sensor or insulin treated type 2 diabetes. So these were only two indications, and they were considered therapeutic devices. So this gives you the background that why we are talking about the over the counter and the prescription based devices. And what is the meaning of the over the counter? In 2024 25, the US FDA actually approved a new category of the CGM. And this new category of the CGM is the OTC CGMs or the over the counter CGMs. So this means that they do not need any prescription. So accessible without a doctor's note. So this is how the prescription changed. But at the same time, we need to understand that this CGM device is not the same CGM device which comes with a prescription. So with this CGM device, they can directly buy from the manufacturers or the pharmacy. It is sold online as well as on retail, and it is intended only for the adults above the 18 years of the age. So this is the background of the OTC. So we are not talking about the same sensor which is given as a OTC and which is given by a prescriber. So this is need to understand. Again, the OTC sensors have very important limitation, and they talk about that. It is not for insulin dosing. So anybody who is using a OTC sensor, it is not prescribed. It is not indicated. So you cannot say that yes, I will use this sensor and I can adjust my insulin doses. So it is not recommended. It is not people who experience hypoglycemia. It is not for people with type 1 diabetes. So people with type 1 diabetes, they cannot use the OTC sensors, and it is not a diagnostic tool. So diagnostic tool means that you cannot use the sensor simply to say that I am having someone is having diabetes. So what it does, why still the FDA approved the OTC sensor? So I would like to highlight those things and why it matters in our clinical setting. So glucose biosensors for metabolic awareness. So there are two sensors which are currently approved in the US. One is the Dexcom Stelo, and the Abbott is having the Lingo. So these two sensors are the OTC sensors approved in the US. These are direct to consumers. And the examples of the prescription CGMs, you all know, the Freestyle Libre 3 or the Dexcom G7. This is how the Indian market and the US market differs. So US market and the Indian market differs. As I already mentioned, they have strict rules, access to the insurance, and it is clinically controlled. So this is the how the US market works. So prescription rules are very strict. Insurance coverage determines the access, not the out of the pocket expenses. And the US debate, when this debate happened in the US, it was more about the regulatory expansion. When we talk in India, so CGM sensors are already available in the retail market. They are available online. So patients are already buying themselves. And self-pay market. So no insurance coverage is covering the CGMs now. And the prescriptions are rarely enforced. Even if somebody says that it is a medical device to be prescribed, we can get any kind of drug without prescription in India. This is a reality. So again, so this is how the markets are different. So India debate is more about the responsible use, and I'm sure Dr. Dr. Ranjit will also agree that we are going to not debate because it is not about the OTC. But if someone gets a sensor without a prescription, so what are the advantages which I am going to highlight, and what are the disadvantages Dr. Ranjit will highlight? So I would like to look it into a from the lens that increases access, and to me, the access is progress. And why I am saying that? So if a person is getting the access to these devices, they can probably track the glucose trends. They can receive in-app education because these are the sensors, especially if you are using these two devices, provides in-application education. and you can set your metabolic goals. You can also learn from the real time feedback. So these are the advantages when you have the real time access. So access is improved by these devices. I will highlight some of the key scenarios, and you may not completely agree with all these, but now there are studies which say that even if you look at the pre-diabetes, and if someone is getting right kind of education and the devices, and they learn that how their glucose patterns are like, they can change their behavior, and this can actually help them in preventing the progression of pre-diabetes to the diabetes. Obesity is again another space where time in range data can help facilitate the lifestyle changes. We know that lifestyle changes are very, very important, and the this CGMs, they can help support better health outcomes. This is a known thing, and if we talk about science and paper, there are many papers. Gestational diabetes is another important thing, because you know that the CGMs, they were not approved now, but with the availability of the OTC CGMs, the GDM is covered under this, and people can buy from their pocket, and they can monitor their glucose levels in a better way. So this offers a higher quality of life, higher better monitoring during the pregnancy, and you can see the changes, and you can consult your doctors. There are another areas like many of the people with diabetes who lack insurance coverage. So how do they get? So even if they prescribe and the insurance coverage is not there, so even if they want to use a CGM, this is the US setting, but they will not be able to get the access to the CGM. So that is how the access to any kind of CGM improved their ability to use these devices for better care. Now, there are many studies which are happening, and they say that athletes suggest potential for enhancing athletic performance. Now, because how do this happens? Let me just give you a background. Many athletes, they wear the CGM devices now, and they find out the glucose levels, the peak performance levels. And now they are trying to train back and see that at what point of time they are hitting the highest glucose level. So it is not just about the normal or the time in range. Sometimes seeing that where the glucose levels were peaking, and it has been seen that it is whether related to the increased physical performance, increased performance during the athletic activity. So this is a new area where these biosensors are providing insights, and the athletes are using it for the training. So they get access when you don't have these are available at the OTC places. General population, we all know that if you want to prevent anything, many any metabolic diseases like diabetes, hypertension, obesity. So I would just cite an example. If you look at go back around 30 years, uh, the glucometers or the glucose meters, they were only the hospital devices. They were available only in the clinic. The BP instruments, they were available only in the hospitals. Nobody was measuring the blood pressure at home. But now the pulse oximeter, you have the BP monitors, the glucose monitors. They are part of each and everybody's emergency kit in the home, and they have these tools. Many of the people, they have these tools. And similarly, I believe this is the time where the OTC availability of these sensors over the counter increases the access of these devices. Again, this is an area not of much importance to the India right now, because but globally it is accepted that even if you screen someone for type 1 diabetes and you find that there are some antibodies which are there, but the glucose levels are still normal, if you put those people, those children on CGM, you can probably prevent the fatal episodes of the diabetic ketoacidosis in such a population. So this is another emerging area where the CGMs are being can be used. Just to sum up, I would like to just highlight that there is a prevention gap. The type 2 diabetes develops gradually. Pre-diabetes is often asymptomatic. Many individuals, they remain undiagnosed. So, my question is that if somebody wants to look at their glucose level just like they want to look at their blood pressure, why should we deny this opportunity to them? So another important thing is that how do we change our behavior? So there are many biological studies, there are many research papers which says that it is the biological feedback which is the most important driver for the behavior change. So if you tell somebody that don't eat sweets, don't do that, probably it doesn't translate. And we see in our clinical practice, even if when we use CGM in our patients, we see that the moment the patient sees that there is a spike after having a big lunch or big dinner, the next day the patient reduces the diet on his own, and his experience is that the spike was not that much. So over a period of time, the glucose levels settles down. So this is to highlight that the behavior science shows that immediate feedback is more powerful than the delayed feedback. So if you get the feedback in real time, then probably you are more likely to change your behavior. And seeing glucose rise after certain foods increases dietary awareness, and the patterns are easier to understand than isolated lab values. Supporting early detection. So CGM can help in early detection of metabolic disorders. And I will just say that glucose is another biological marker. When we look at the pulse rate, we can look at the other parameters. Why not to look at the glucose level also? So this is the last slide. So I will just say that OTC CGMs doesn't mean that we are replacing physicians. It doesn't mean that we are that they can diagnose diabetes. It doesn't mean that they can eliminate risk, but they may increase metabolic awareness. They may encourage earlier intervention in some cases, and support lifestyle modification and expand access to the physiological data. So the question for me is not whether data should exist. My question is that how responsibly we should use it. So with this, I would like to say that this is an opportunity, a preventive opportunity, where if the data insights are available, we can do better in the prevention space. So thank you so much.